be speaking while it was muted. Good afternoon, everyone. Thank you so much for taking time out of your day to join us for this important topic. We started our Zoom resident panels last month. We had our first one, and it really came out of the panel groups that we used to have here at La Posada to educate and talk about the things that are ongoing here. And we think it's better to hear directly from our residents specifically about the things they love about La Posada and things that are important to them. And so, of course, as we all know, we're on this call to talk about the COVID-19 vaccine. And so we were one of the first communities back in December 21st to roll out the vaccine to our skilled nursing residents and to the associates that take care of those residents in our health center. And so we noticed at that time, a lot of families had a lot of questions. A lot of our residents had a lot of questions. And so we learned a lot from that early experience. And so together as a team, we decided we wanted to create a Zoom panel discussion, highlighting a number of keynote speakers that we have on the call. I'm going to introduce here in just a second, and then also have some of our residents talk about their experiences here at La Posada. And so we also want to be an educational facility or community that really educates the greater community. And so we assumed that a lot of you who are on this call, I think we have over 100 participants, which has been an excellent turnout in regards to the information. And so we were right in knowing that people want to hear about this and want to learn more. And so I'm excited to be able to hopefully share with you, as well as the individuals that are going to be speaking today, to educate all of you on maybe questions that you have as well. So that's kind of how we got to deciding to have this call today with all of you. So today we have a number of speakers. Some of our keynote speakers will be Dr. Canasi of the Canasi Medical Institute. Dr. Canasi has been a vital part of our community. He's been our medical director for many, many years. And so we're very thankful that he's able to take time out of his day to join us on today's call. In addition, we have Mizuki Berkeland. She's our National Director of Environmental Health and Safety for Kisco Corporate. And so we thank you, Mizuki, for taking time out of your day and joining us for today's call. In addition, Ken Heinrich is our healthcare administrator. He oversees the entire healthcare center for me and for us here at this community. And so we're thankful that he's on the call as well. For our resident panel, the most important individuals are residents. And so we have Noel Trachtenberg, who's joining us today. We have Faye Hunsinger, Carol Mostad, Heather Little, Fred Kohlmeyer, and then we of course have Ann Remkes, who's our moderator for today's call. So right now I'd like to go ahead and turn it over to Dr. Canasi for his part of today's Zoom meeting. Still muted. Dr. Canasi, you're muted.
You hear me now?
Yes, sir.
So keep in mind that this disease is very fluid, and the science is evolving every day. And there are a lot of information that's out there that may be accurate and may be inaccurate. Unfortunately, one of the important parts of healthcare and medicine and science is the ability for healthcare providers and researchers and academic people to be able to get together and share information. And this disease has really put a wall or a barrier on this. There are two sides to this disease. One is what I'll call outpatient, and the other one is inpatient. The inpatient part of the disease, the data and the science is much more clear because it's much more organized. The outpatient part of this disease, or the studies to try to do outpatient therapy or evaluation of outpatient epidemiological studies, is become a little bit more of a challenge because of the fear of the disease. Individual physician practices are not open. Trying to get physicians together to enroll in studies are very difficult. Patients' acceptance of coming to the practice has been difficult. So for that reason, a lot of the therapy, outpatient therapy, has been very murky and very inconsistent, okay? Just a little bit a reminder about this disease. This disease started back approximately 8-9 months ago. It is a new virus. The SARS COVID-19 virus is a coronavirus. Coronaviruses have infected previously. The last one was the Egyptian virus, which was pretty bad, but nothing like this. This is the first time that we've been challenged with a de novo virus like COVID-19 in my lifetime. And if anyone would have asked any healthcare provider if we ever thought we would be entangled in something like this, I think most of us would have been flabbergasted to see this in the future. So this virus has an enormous amount of conflict. Number one, it has a high morbidity and mortality. Number two, it has led to financial crisis globally. Number three, the psychosocial impact of lack of socialization. Family members aren't able to get together. And lastly, the educational impact of kids not being able to go to school. And one more piece to that is the post-COVID syndrome. Now, this syndrome is patients that have COVID and for some reason have symptoms many months after. We don't know why. We don't know why some patients get it. And we really don't know exactly how long it's going to last. There are two parts of this disease that are important. One is what we call treatment therapy, and the other one is prevention therapy. On the treatment side of this disease, we have two parts that I like to separate. One is outpatient therapy, and the other one is inpatient therapy. And we're hoping that as time goes by, we'll be able to blend those therapies to keep patients out of the hospital and getting sick. I personally have been involved with a couple of studies, including the monoclonal antibody and the remdesivir studies as an outpatient. And I can speak a little about my personal experience in enrolling patients in these studies. But as an outpatient therapy, we have monoclonal antibody. Number two, we also have antiviral therapy, which is called remdesivir. And lastly, we have Decadron. These three drugs, right, they're all really for inpatient. Now, the reason for that is because of lack of availability. Remdesivir is an infusion. It's very hard to give as outpatient. Our country's not set up to be able to give infusions at doctor's offices anymore like we did many years ago. There aren't infusion centers available in cities. So most of that responsibility has been left to the hospitals. The hospitals, because of their inpatient volume of COVID, their inability to staff because there's such a shortage of healthcare staffing, they're unable to do both, take care of the outpatient and manage the outpatient. So most of the treatment is left sort of on the curve side. Remdesivir has not been approved for outpatient yet, but we actually have two studies going on right now with remdesivir. One is to treat patients either infusion, and the second one is an aerosolized form of the antiviral. We should have some available data soon, and once that data becomes available, my hope is that we'll be able to have a easier format to give this medication to outpatient patients who test positive. The monoclonal antibody has received FDA emergency authorization for treatment. The treatment, unfortunately, can't be given to everyone. So the FDA has set certain parameters. There are two companies, Eli Lilly and Regeneron. They've both been approved. The FDA right now requires monoclonal antibody to be made available to patients over the age of 65 who are felt to be at risk for severity of disease, and for patients under 65 who have mitigating circumstances such as morbid obesity. Okay, Decadron is an inpatient treatment only. It should not be used as an outpatient. There's no further role for hydroxychloroquine, Z-Pak, or steroid. One thing that we encourage is everyone to take vitamin D. and zinc. Not that it prevents the disease, but those patients that do get COVID for some reason, it appears that maybe vitamin D may have an impact on the immune system response. And then lastly, what I'm here is to discuss the vaccine. And there are a lot of speculations about the vaccine, but the FDA has approved 2 vaccines, Moderna and Pfizer. Let me first tell everyone the story of vaccine, how we came to vaccine, and why vaccine is so important. Does anybody know anyone that has polio? No, right? Polio has been eradicated because of vaccine. Chickenpox, rubella, measles, all of these viruses have all been eliminated because of vaccine, okay? So vaccine is very simple way to understand it. A vaccine basically mimics the infection, the actual pathogen, the bacteria or the virus. Either we modify the virus or we take a piece of the virus on the surface of the virus is something that's called antigen, and we expose the body to either an attenuated form of the virus or a piece of that surface, which is called the antigen, so that the body's immune system can be primed, so that the next time the body is exposed to the actual virus, it can have a very, very quick response to avoid infection and destroy the pathogen. So that's all a vaccine does. These vaccines are relatively new. They're called messenger RNA vaccine. They're not even attenuated viruses. This vaccine came as a result of the brilliance of researchers. Now, keep in mind, we have a vaccine in 8 months. The ability to achieve that is a credit to the scientists, not to the physicians that were treating it, but to the scientists. Every scientist in the world put aside all of their research, whether it's on diabetes, multiple sclerosis, breast cancer, cardiovascular disease. These brilliant scientists put everything on their side and focus together to find a vaccine for this disease, and they have. And because of this virus, because of the vaccine, we're going to be able to have an impact. The vaccine has been given emergency authorization use. Simply what that means is it doesn't have the FDA approval, but the FDA has reviewed the data and has recognized that it's, number one, its efficacy. It achieves the end result, which is antibody production, and also stimulation of cellular immunity. And number two, that the side effects were safe. So if we take into account the number of complications from the vaccine versus the number of the morbidity and mortality from the actual virus, right? The benefit of the vaccine outweighs any danger of the vaccine. The vaccine comes in 2 formats. One is a 2-shot vaccine, which is a little bit cumbersome. Number 2, the vaccine, some of them have to be stored in certain freezers that makes it unavailable for most physician practices. Only commercial pharmacy or hospitals have that capacity. So the Pfizer vaccine, the storage becomes difficult to be provided at individual physician practices. Those are 2 vaccines, and the same one with Moderna. They're both 2 vaccines. The efficacy of the vaccine is thought to be around 94 to 96%. What that means is that in the majority of the patients, they're going to have an antibody response, an IgG response, and a T cell response the second or third week after the second vaccine, and that will deem them immune to COVID. Now, that doesn't mean they can't get COVID. What that means is as long as the COVID doesn't mutate and it becomes resistant to the vaccine, that individual, if it's exposed to the virus, will have a robust immune system response and will keep their body safe from getting infected or from being able to acquire the disease so they can infect others. Now, remember that this virus has one mission only, and that is to infect 6 billion humans. That's the mission of this virus, and it won't stop until it achieves that. And there's only two ways to minimize this. One, we all live in a cave and never expose to each other, because we're the carriers. Humans are the carriers. It lives in our nasopharynx. We cough, we sneeze, we breathe, we touch, we bring our fingers to our mouth or nose, and we acquire the virus. And that really is unrealistic. The only other option is vaccine. And we hope that we can achieve what's called herd vaccine. And herd vaccine basically means that the majority of the population is vaccinated so that the virus can't continue to transfer from human to human and the virus will burn out. Okay, that really is the hope for this virus. If that is not achieved, then the second option is that the virus will mutate, okay, will probably become less virulent, but more transmissible. And then the vaccine will need to be modified so that it can incorporate those mutated components into the new vaccine. So there's a lot of hope, and a lot of hope with this vaccine that we'll be able to control the disease. We'll be able to bring people back into society. People will be able to socialize. Children will be able to go back to school, and we'll have a greater ability to travel across globally without the fear of getting infected. So the vaccine is the key, and I encourage everyone to let everybody know how effective the vaccine is and how safe the vaccine is and how important it is that we vaccinate all humanity as much as we can. Because if we only vaccinate 60%, 50%, it's not going to achieve the outcome that we need, because then you have another segment of the population where the virus can mutate and then it can affect the rest of us. That's why the vaccine is so important, okay? It should not be politicized. It's a scientific fact that the only way to stop this disease is to make all of us immune so the virus can't infect us and we can't transmit it. And then the virus, if it can't transmit, it'll happen like the previous SARS, it just burned out and it'll go away. That's my hope. I don't know if that'll happen, but I think it can if we immunize the majority of humanity, which is a big task. The vaccines are being given to what we consider the high-risk group. That group is 65 and over. Senior citizens are a high-risk group. We think that it's probably related to a immune mechanism defect, okay? And hopefully, as soon as we can get that group of the population vaccinated, then the general public will be able to get vaccine. Here in Florida, we're vaccinating approximately 350,000 people a week, and that number is going to go up as the vaccine becomes more available. I believe that Governor DeSantis today opened up Publix in all Palm Beach County, and I personally think that's the way it needs to be done. It should not be done in doctors' offices because it's too difficult to be done. It should be done in senior facilities, nursing homes, assisted living facilities, and the general public should be able to get it at every grocery store, every pharmacy, the fire department, the EMS, anywhere, everywhere, ballparks, anywhere in the community, the vaccine should be made available for everyone. I think that eventually you'll see that the colleges will mandate, or hopefully will mandate, in my opinion, that all college students be vaccinated, because they're the vector. They get it and then they bring it and they infect the older population. So it's important that we not only keep safe the people that are at risk because of age or because of comorbidity, but we also start recognizing that the vector needs to be immunized so we can stop this transmission. And with that, I'll open it for questions.
Thanks so much, Dr. Canasi. Do you think anyone attends or have questions for Dr. right after this?
I do see a question, Dr. Canasi. One that came through says, once I get the vaccine, will I be safe from COVID and the flu, or do I need to get both?
No, COVID is SARS and flu is influenza. You need both vaccine. Okay, you need the influenza vaccine and you need the COVID vaccine. But please make sure that you don't do it on the same week or 2 weeks apart. You know, the COVID guidelines, I think you should not have any vaccine or be sick within a couple of weeks. And the other thing is that in anyone that's had COVID, right, they should not get the vaccine until 3 months after, or anyone that's had COVID that's gotten monoclonal antibody. And monoclonal antibody, let me just tell you guys what a wonderful therapy that is, because I probably have treated close to 300-400 patients, and I haven't had one single death, and I've had one single hospitalization. The majority of my patients, I enter into the research for monoclonal antibody, and the monoclonal antibody has changed the way this disease is treated. Monoclonal antibody was made by Regeneron. All that is a synthetic antibody that basically is guided to the surface spike protein. The virus has on the surface of the virus has a protein that's called a spike protein. Just think of the name, the spike. The spike allows the virus to enter and replicate. The monoclonal antibody attaches to the spike protein so that the virus can't replicate anymore or can't enter the host cell. So the monoclonal antibody, if you've had a monoclonal antibody, if you take the vaccine, it may impede the function or the ability of the vaccine to create an immune response. So we tell everyone 3 months from the time that you got sick and from the time that you got the monoclonal antibody. And lastly, I'd just say, as far, because I know I've had patients have asked me this question, how long will your antibodies last? Well, we think antibodies will last at least 9 months, 8 months, probably longer. But like I said earlier, this is very fluid, and every day, every week, every month, we have new evidence and we have new recommendation.
Okay, I'm seeing another question. Sorry. Seeing another question here that says, how do you think the vaccine, you've been affiliated with La Posada this whole time. And so now that you talk about hope, how do you see the vaccine affecting life at La Posada for our residents?
Well, I think we have to get everybody vaccinated first, okay? And then we have to determine immune response. And so hopefully we'll be able to get antibodies, right? And make sure that everyone that's got the positive antibodies, right? Then they're considered immune. Now, what's going to happen afterwards, I'm not sure, because that's not just a medical decision, that's a government decision. I don't know what the government is going to recommend, what Dr. Anthony Fauci is going to recommend after the vaccine, whether we still need to wear a mask, okay? Or those people that have been vaccinated can have a more free travel and free socialization without having to social distance or any of that. In theory, once you're vaccinated and you have antibodies, you're protected. So typically you shouldn't have to wear anything. You shouldn't have to do anything, but we have to wait for the CDC and other agencies to come up with that recommendation.
And I can speak to that a little bit, because we've already vaccinated, as of yesterday, almost 96% of our residents here at La Posada. Yeah, so we've had a great participation. And I can tell you that just the change in the morale and the sense of atmosphere in the community because of them receiving the vaccination today has just been amazing. So there's such a peace of mind once you get the vaccination that you're on your way for this to officially end at some point in time. And so I saw a big change in the morale in our residents and their attitudes today. So,
Brad, I'll only say that just remind everyone, and we need to really enforce this because we are seeing people getting sick in between, that after you get the first vaccine, you're not immune. You're immune after you get the second vaccine 3 to 4 weeks later. Okay. Yes. So it's important that when you get the first vaccine, you don't let your guards down.
Correct. All right. Any other questions, Ann, that you see?
I see one other one, Dr. Canasi, and that is, I'm sorry, Rick, I keep trying to unmute myself, so I apologize. One other question. Once the vaccine is administered, will that person have to continue to get COVID tested? Or does that mean they're walking around with a piece of paper that says they don't have to?
Well, once you get the 2 vaccine, that'll be up to the government to decide how many. You're going to have everyone has a piece of paper, but in theory, that's going to go to what's called the vaccine database. Okay, that's where we go in and see what people have had, and what the government or what the agencies are going to do with that. I don't know. You know, Brad, I'm not sure.
Yeah, we do have a CDC card that every resident got. So basically it says we provided the Pfizer vaccine here. So every single resident got the dose of the Pfizer, the date they received it, the person who administered it. It's on an official CDC card. And what will happen is they'll get the second shot here 3 weeks from yesterday. The majority of our residents, and then that'll put the second date on the vaccine card, and they actually get the card. And then you can actually either you keep it on your person or you're able to register it. And so we had a sheet from the CDC on how you can actually register that you've gotten the full vaccination process and completed that. Residents were excited about that as well, having that documentation.
And I'm sure that everybody wonders why, for the first time, we're doing something like this. But you know, there's some rumors that in order to travel, you're going to have to prove that you've been vaccinated. To go from one country to another, that's going to be probably required. Number 2, the airline may mandate that you be vaccinated. Now, there are circumstances where you can't be vaccinated. If you have certain allergies, or if you have an allergic reaction and you can't get vaccinated, you can't get vaccinated. But for the most part, you know, there is a emphasis on making sure that we track everyone that's been vaccinated, and there's a purpose for that. I'm not sure that I'm not sure that that's being done simply for our entertainment, but for the greater good, that we need to figure out how do we get everyone vaccinated and keep everybody safe.
Yep. All right. Well, thank you so much, Dr. Canasi. We appreciate your time. If anyone else has any questions or anything, please feel free to type them in. We're going to keep it documented, all these questions, and then we can also send out a fact sheet with everyone's questions or anything that we missed. But thank you so much for your time. You have a great afternoon.
If anyone or anybody's family gets ill with COVID, they haven't been vaccinated, please call our office and we will get them treated through our research department. Okay.
Thank you so much.
Treat them early on, okay, before they get sick.
Great. Thank you, Dr. Canasi. You have a great day.
Thank you. I'm going to go away, okay?
Yes, sir.
Bye.
Wonderful. Next, I'd like to, yep, I'm not muted. Okay, wonderful. So we've got Mizuki Berkeland, our National Director of Environmental Health and Safety for Kisco. So I think she's our next speaker.
Hi, everyone. Thank you, Brad. Good afternoon. I'm here to briefly speak about how the vaccine, what it means for Kisco, and how it's part of our ongoing part of elevating the senior living experience and as part of our Kisco confidence as a whole. So, you know, the vaccine and how it goes into our Kisco, you know, overview of keeping our residents and associates, everybody who touches our community safe, is that it is what it is. It's another tool in the toolbox that allows Kisco to commit to the safety and security. And so, you know, many of you have experienced this, but with our continuous testing and surveillance through our pooled testing, just a fun fact for you all, since the fall when we started, over 50,000 tests have been conducted across all of Kisco. So it's a lot of surveillance, and it's allowed us to more quickly identify areas of COVID transmission in order to try and, you know, keep more people safe and to prevent the transmissibility. You know, in addition, we have our COVID protocols, so masking, social distancing, enhanced cleaning protocols that have been introduced in order to, you know, keep our environment safe. But I think with the vaccine, it's just another tool that we can add where it allows for individual protection for everyone who is able to receive it. And then combine that with environmental precautions, you know, I think it really opens up a sense of relief and freedom, and similar to what Brad just said, and also hope, like Dr. Canasi just mentioned, it's wonderful. And I think it's a great tool, if you feel that it's the right move for yourself. I think in terms of elevating the senior living experience, I kind of like to think of it as like adding to the quality of life. So for our residents, a sense of safety, right? And knowing that you yourself are protected, just being as a high risk group, just as a population. But I think also for associates, what we've been trying to tell everybody is it's safety for themselves and their families and loved ones, so that they can then fully focus on, providing the best care as possible for our residents and then for our community. Hopefully this will mean that, we can get to a eventual return to normalcy, or whatever we want to call as a new normal in this post-COVID world, hopefully quicker. And so that, everybody who touches the community is able to fully, take in the areas that they came to La Posada for. I think I'd like to also speak to as a testament to La Posada and all of our communities who are doing the vaccine administration, trying to make a huge effort in rolling the vaccine out as seamlessly as possible. This is not easy, this is a once in a lifetime pandemic, unfortunately, but all of the work that's been going into it, I think, is to be commended for everybody on the front lines. And I think hopefully that's also helping to elevate everyone's experience as being part of this community. And then finally, I'll end with, how does this really tie into Kisco confidence? There are many parts of it: safety, security, trust, peace of mind. Kisco confidence at the end of the day is a combination of our multifaceted initiatives to ensure that everybody, again, who touches the community is safe and feels, like this is a great place to live and to work. And so hopefully this vaccine, having the ability to receive it, being part of a priority group, which is, I think, a wonderful opportunity. There are a lot of people who really want it out there, and unfortunately, just because of logistic challenges, that's not able to happen yet. Hopefully those who are maybe on the fence is able to get the information that they need so that they can make the best decision for themselves and their families. Brad, I think you're muted.
Thank you. Yes, I was muted. I just want to say thank you so much. We really appreciate that. And thank you for joining us.
Thank you for having me.
Next on the agenda, we've got Ken Heinrich. He's our nursing home administrator. Ken has been integral over the past many months on working at getting us vaccinated as quickly as possible. He was integral in that date of December 21st, being the first community in the Palm Beach Gardens area. And so I wanted him to speak about what that looked like, how it was administered, and share with you all a little bit as well.
Sure. Thank you. Good afternoon. Yeah, at our health center here, we were one of the first skilled nursing facilities in the state of Florida to have a vaccine clinic, and we were very fortunate for that. Vaccinations is but one part of our COVID protocols that we have in place here, in combination with our screening, our daily screening that we do, the weekly testing that we do, and then vaccinations are that third integral part of keeping our residents and our associates safe here. So we had our first vaccine clinic on the 21st, and that was in large part set up. We partner and communicate daily with the Florida Department of Health, their biological science department, the state epidemiologists, the CDC, the American Healthcare Association, and we're very in touch with them, and we're able to communicate with them when they announced Operation Warp Speed that long-term care facilities would be able to partner with Walgreens or CVS to have these vaccines administered for residents and employees of long-term care facilities. So we were very anxious to have that done and to be part of that, and thankful that on December 21st, we had our first vaccine clinic. I think it was a pretty well organized event. We held it over in Mallorca. Walgreens was the pharmacy that we partnered with as part of Operation Warp Speed. They came out with several pharmacists and several of their med techs to administer the Pfizer vaccine. At this time, Moderna hadn't even had their vaccine approved. So what we started with was the Pfizer vaccine. And that's the vaccine that we've also been given in subsequent clinics, which happened on January 11th. And then the most recent on this last Monday, January 18th. So yeah, our residents were able to come down and be vaccinated by the staff at Walgreens, and our associates were there as well. We had a very, very good turnout with our residents. It was a very positive reception to the vaccine. I think we had 95% who were vaccinated on that day. And I haven't heard of any real major side effects or complaints. Everyone's felt good about it. And most of those residents who were vaccinated on the 21st have also been vaccinated their second vaccine, which is the booster shot they received on January 11th. So we've actually already got that out of the way as well. I haven't heard any other symptoms or adverse reactions. The most common is simply like a sore arm at the injection site. And I've heard a couple people discuss being fatigued or perhaps tired for a couple days, maybe someone with a headache, but I haven't really heard anything else other than that. So it's been a very positive experience. And I know Dr. Canasi talked about the impact that it would have, answered that question on life at La Posada. And for us here in the skilled nursing facility, it has definitely put our minds at ease. I think from a point of our residents feeling more comfortable visiting, because I think everyone's very conscientious and worried about either being infected themselves or infecting others. So, you know, when they have those visitations with their loved ones or any interactions, I think everyone's just a little bit uneasy for the last year, obviously. And I think this has helped put a lot of minds at ease and made them a little more comfortable or a little more willing to spend time with their families and things like that, knowing that they have this protection in place. Of course, we're still following up with all of our screening, all of our testing, all of our infection control protocols. You know, as those things, we're waiting to see ultimately how it will affect life. But right now we're continuing to remain vigilant, wearing masks, protecting each other. And we're just going to trust in the, you know, Dr. Fauci and the people at the CDC to see ultimately what happens with this. And hopefully it gives us a little more flexibility and normalcy in the months to come.
Thank you so much, Kim. Appreciate that. You know, one of the things Kim didn't share is really how we got that December 21st date. And that was, as he stated, we were one of the first communities. We weren't the first community they called, though. And strangely enough, you know, they actually had called a number of other facilities and communities in the area. It was on a Friday, and they were turned down. And so they weren't ready. They couldn't execute on a Monday at 8 o'clock in the morning. And so Ken, without equivocation, said, yes, we can make it happen. And myself and the entire leadership team, including Ken, worked all that weekend coordinating for us to be able to vaccinate our residents because we felt it was so important on that Monday morning at 8 o'clock. And so we moved heaven and earth and did a great job doing that. And we're not going to turn them away with our residents getting the first opportunity to get vaccinated. So thank you, Ken, and thank you for all the leadership that had a big part in that. And I think you're next. We're going to have some questions and answers, and then so that we can have specifically for our residents. So I'll turn it over to you.
Awesome. Well, I'm seeing lots of questions coming in, and if anybody else would like to add to the list, just make sure you type it in under chat, and we will get to your questions kind of in order of how they've been received. So I'm going to pose this first one to Ken, I think, because the question has come up is that we heard a little bit about how life at La Posada has, and is great from a resident's perspective. Are the caregivers that are receiving this, do you see like a new, those are the frontline workers, and they have been challenged like crazy in the past 10 months. Have you seen a change in their, like there's a little lighter in their step, they're more hopeful? Ken's muted. Sorry, Rick. There you go.
Sure, I got it. All right, thank you for that. Yes, so mainly the changes within really the morale and our attitude. Our actions, our disciplines, the things we do on a daily basis to take precautions, there hasn't been a change in that, like I said. We know we've been vaccinated, and that does put some peace of mind. However, we're still, wearing those masks and using those gloves and those gowns and those face shields and all that PPE, equipment that we use, and taking all of our, steps to prevent this as if it still could be spread. So until we have more information, that tells us that we can back off of some of these protocols, our daily actions haven't really changed. However, there has been a significant change in the morale. And I think just the, again, the mood or the minds, a lot of us are talking about it. It's just hopeful that there's a light at the end of the tunnel. We're all really tired. We've been working really hard. And yeah, these people here, they're just such a wonderful team, tirelessly to do everything we can to care for our residents in this time. It's been very difficult, but I think they're just really, really, really happy that this might be the light at the end of the tunnel, and some sort of return to normalcy, sometime this year, summertime or fall or whatever that might be. And I think we're all looking, forward to that. And I think everyone was looking to do their part to make sure that that happened.
Sure, that is a great answer.
Hey, and just to add just a few things real quick, I think it's been vital over the past, 8 to 10 months here at La Posada in regards to the leadership. We've all partnered together and worked the front lines with our associates. So we've all been in this together with one focus, which is to take care of our residents. So that's number one. I think that's helped morale a whole lot because we've all been in this together. Everyone's on the front lines and we're all supporting and doing everything we can to take care of our residents. Number two is our associates have never had any situation where they've been concerned about PPE. In fact, we provided PPE masks and stuff for our residents on a regular basis. We got back in March, very early on, noted that this was going to be something that was integral and vital as we move forward through this whole process early on. And we began to get the amounts of supplies that we needed for our associates and for our residents so that they can wear masks around, all the time. And they didn't have any concerns with needing PPE or requiring PPE. And so I think that was really something that helped our associates on the front lines because they had the equipment to be able to take care of residents that they didn't know if they had COVID or, or any of those things. But there was peace of mind in knowing you had everything you needed to securely take care of someone. The other big thing for morale for both our residents and our associates is, I think Mizuki mentioned it, Kisco has done over 50,000 COVID tests within their communities. And so we test our associates twice a week and we test our residents once a week so that there's peace of mind. I think if you get a sore throat or cold, you don't feel well, the first inclination is, I wonder if I have COVID. And I don't know if anyone's driven around and gone to any of these COVID sites where they're doing the testing, but it's 100 cars, hours long waits. And our associates and residents have never had to worry, go fend for themselves to try to go fight to get a COVID test, because we are there again, very early on, Kisco said, hey, listen, we can monitor our residents. This will help us open up our communities. We'll know if someone has it, we'll be able to jump on it immediately to do contact tracing and do the things we needed to do. And it has allowed us to have a safe and secure environment over the past probably 4 months by the amount of tests that we do on a weekly basis, knowing that we don't have COVID in the community, and it's allowed dining to open, events and activities, and allowed it as freedom to enjoy this community a lot more because of those things. And so that has all helped both the residents and the associates with the morale over the past many months here at La Posada.
I think a great follow-up question to that, Brad, is one that came in that says, are you, from the get-go, you've been putting social distancing in place for restaurants, the common areas, and the fitness. Can you talk a little bit about how you plan to maintain that as you continue to open up those opportunities?
Yeah, so we believe those are the pillars of our success here at La Posada. And so we're going to continue to do some of those things. We have dining, we've opened our dining rooms, but we've done it in a safe way. We have clear plexiglass, we've spaced individuals out, we've limited our seatings, used multiple dining rooms. And so we've leveraged that flexibility, and we have had any cases of anyone acquiring COVID or getting it in those situations. We're testing our associates, are actually serving them, and has allowed us to open up the community. More so than anything, it's the health and well-being. So exercise classes, events, and activities, we can test those that are coming into our community in advance, know that they don't have COVID. So we've had some entertainers that came in for safe entertainment. We've been able to do things in a way that some of these residents, I'm sure, are going to speak about here in just a minute, about how they've been able to enjoy safely the community and allowed us to open up because we've created what we call that safety bubble around La Posada.
Mm-hmm. Well, I think that's a great segue to Noel. I'd like to pose this question because I think it's really important, and you've been there for so long. What is your advice to somebody who is thinking about a move but intimidated to do it during COVID, and not sure that they want to make that commitment? What would be your advice to make the move or stay at home?
By all means, come join us. From the very hint of there being an epidemic out there, which is last February, our director, Brad, shut down the health center, made it off limits to any independent living residents. Shortly thereafter, he got the associates together, and this includes drivers and servers and some aides. They went shopping for us twice a week. It later got to be once a week because the stores were getting empty. They did everything they could where we would not be at risk. And they subjected themselves to potential risk, but they had been brainwashed as to how to prepare for it, with gloves being changed as they entered the store, left the store. They took care of our going to doctors when necessary. We have, thankfully, a very good health staff on campus, including people such as a licensed nurse practitioner who makes house calls, brings in x-ray equipment if necessary. We have an on-site nurse who's here Monday through Friday, regular office hours. We have an outpatient clinic where residents can have physical therapy. You really don't need to go out. As a matter of fact, my husband and I, we've been here 11 years. And aside from mandatory trips recently to Publix to get ice cream, we go out very, very rarely. The car needs a wash, so be it. But we're holding activities as much as possible here with groups of safely distanced residents. As a matter of fact, they just fabricated a plastic shield where 4 people could play bridge or mahjong, or yesterday it was hand and foot. So if it can be done, our staff will do it. So please come join us.
That was awesome. I have, I'm going to follow up with a question to Carol, because I believe, Carol, you're actually able to visit your family locally because of the safety protocols that La Posada has put into place. Have you had the vaccine?
Yes, I got the vaccine yesterday, and I was really happy to see this being accomplished and so many participating here at La Posada. I moved in here in June, after the pandemic started. And I actually chose my apartment by a virtual tour. I never saw it until I moved in, and it worked out very successfully. I must compliment the administration here on just working so hard to keep us absolutely safe, to keep us amused and entertained with so many activities, as Noel described. And I'm just very, very happy that I'm here.
That's awesome. I'm going to throw this one to Heather. You know, we've had a conversation before, but there's something really special about La Posada. And I imagine that now with all the different safety protocols, it makes sense too. But you have something to say about the people here, the residents at La Posada, and how you feel about those.
I think the residents here are wonderful. I was first drawn because of their friendliness. And from the very moment you walk in, you feel everyone smiles, everyone is very close and friendly. They're a similar kind of people, I find. The same thing must attract them too. They're low key. They're just your kind of people that you would have chosen as friends in whatever community or place you lived before. I can't believe anyone would come here and not be very happy to have done so, and will find wonderful friends.
That's great. I'm going to throw this one to Faye, actually. There's a question here about, well, what's the food been like since the pandemic took place, and has that changed? I'm not seeing Faye.
Better. We have 4 dining rooms here that were fully functioning until early March, when it became clear that that was not the safe thing to do. Talk about gearing up over a weekend. It felt like our administrators here and all the managers and the associates within, I don't know, 3 days had food delivery to our front doors. We could order by phone. We never needed to leave our apartments. The quality of the food was really good. The only issue probably for a few people was because you were serving however many of us there are here on a delivery basis, you might have to throw your food in the microwave for 30 seconds to heat it up when you got it. But the quality of it, the taste of it, everything that they could do for us food-wise was done. We had to give up some of the welcoming groups, the welcoming new residents and so forth. Some of the monthly birthday party had to be given up. We had to give up certain things, but that never changed how the staff interacted with us, how they helped us, how they provided for us. And it's Noel already mentioned about they shopped for us. They went to the pharmacy for us. They went to the banks for us. They went to any place we needed them to go. I can't say enough about this place. I'm so happy to be here. I've been here now about 1.5 years, and I can't believe what a wonderful decision I made.
That's awesome. I know that kind of going back to the food, the food was still prepared by Chef Clay and Chef Guy, right? They're 5-star chefs.
And we could order from either of the main dining dinner restaurants, either the Waterfront or Mallorca. They weren't both open 7 days a week, but Waterfront was 6 days a week, Mallorca was 5, and we could order from either one. The menus are different. Again, very well prepared, very varied. So I think you could find between the two on any given day or night, you could find items that you would really enjoy.
Well, and Noel, there's something special about having the outdoor space. You know, I heard you guys have already opened up for alfresco dining. Oh, we're muted. Sorry, Noel. Let's see if I can unmute you. Hold on, Noel. Sorry, Noel.
Okay.
There you go.
Yes, as Faye was saying, the dining rooms are now open in the evening. We have lunch available, and we can have it delivered or pick it up. We are not yet having lunches in the dining rooms, but there are plans to have certain events outdoors, such as when we had our anniversary party. We were able to space the tables away, so we used the terraces. And if there are two people from the same household, they're able to be joined by two other people from that same household or one other person who is independent, so that we are all protected by the shield barriers. And that makes a big difference because, to some extent at least, we're able to eat with our neighbors. Makes a big difference in morale.
And you can see them.
And you can see them, yes.
Well, I think this next one might be for Mizuki. You tell me, and Mizuki or Brad. I'm seeing something here, a question about Kisco Clean. What's a Kisco Clean room? Mizuki?
Sure, I can take that. And then Brad, if you want to add anything else that I've missed. So Kisco Clean is the process that we use to make sure that the room and that you'll be spending, your time in is fully cleaned prior to your arrival. So what that means is we have a full checklist of all the different items that our staff is doing, enhanced cleaning, making sure that all the appliances that are there work, pretty much all you could ever want in your new home is taken care of. And then on top of that, once that's been checked, there's a sticker that goes on. You may have seen it in some hotels, but it goes on where the door jamb is, essentially, to make sure that anyone who enters that next is our new resident, so that you yourself can break the seal and there's that sense of security that you may have there. Brad, if I've missed anything, please feel free to add.
No, that you did wonderful. In our housekeeping, we did a lot of training in regards to disinfectants, sterilization, germicides, and those things for our residents currently that are living here. And then most importantly, it was a really concern of, a resident coming into their new unit, who's been in there, if there's anything there. So there's a lot of concerns with that. And so we want to alleviate that and eliminate that. And so the Kisco Clean, was kind of came out of that. And I think the biggest thing is that you can be assured that once you go to that unit, you break the seal of that unit, it's sterilized, things are clean, and there's no concern of germs or anything that would be in that unit. And it just gives another layer of peace of mind to our residents when they first move into a new unit.
Awesome. I don't know whether you can answer this or not, but there's a question that's come up. Is it how would we be able to know where the vaccine is available? Is it at Publix? Is it at Walgreens? Brad, do you know?
Yeah. So as I think Dr. Canasi mentioned, Publix is going to be carrying the vaccinations. And so in distributing the vaccinations from Publix, I know that's one area. There's vaccination sites. And so what we can do is we can send everyone a link. You have to register in Palm Beach Gardens. We have an email address that we can send out to them and share so that they can go on there. And as soon as the vaccinations are available and they have a number, that they can go to that, email it, and hopefully get registered in our surrounding community. I wish they would allow us. We've got the facilities here and be a vaccination site to give to the greater community, but just not how it's being rolled out at this point, maybe in the future. But we certainly have some resources that we can give to them and share with them so they can know how to register and hopefully get vaccinated soon here in the area.
I'm seeing one last question here, and that is that, being able to deliver the kind of service you've been delivering, La Posada, I guess, is really considered to be 5-star. How has this virus impacted that for you?
So is that to me?
Yes, Brad.
Okay, yeah, sure. So, listen, our goal every single day when our 260 associates come here, it's to serve our residents and our focus every single day. And certainly it was a trying year this past year on how we delivered those care and services. But our 260 associates stepped up and did an amazing job putting our residents first. As you heard from them, they're what makes La Posada, one, a special place to work, certainly a special place to live. And you met some of the best residents we have here. And so our goal every day is to take care of them And so trying to figure that out over the past year has been challenging. But again, every day it's how can we do better? What can we do to take care of our residents so they don't have to worry about anything? And that's from meals to safety and security to how to protect them during COVID and to anything. And so they're our focus every single day. So that's how we focus. That's what we do to do that.
Awesome. Well, I think that we've come to our time limit. So any other questions that come in, we can certainly answer and send a information sheet out or post it on our site, right, Brad? And then if you want to close.
Of course. Yeah, thank you all so much for joining us. Hopefully you learned a little bit about how our residents live here at La Posada, things they enjoy, challenges that we've had. We appreciate you all joining us. If you have any additional questions, like Ann said, please type those or email us. We'll get a fact sheet out, answer those questions. And if you're interested in learning more about La Posada, we'd love for you to come and have a safe visit. We've also structured that so that you can come here safely, meet with one of our sales associates and learn even more about the community and actually see the community, experience the community. That's a big part of making that important decision to call La Posada your home. So if you'd like to do that, so please contact us. You can call the main number and we can get you a safe visit scheduled.
Awesome. Okay, with that, Rick, do you want to close down or say goodbye?
Yeah, again, just echoing Brad, thank you for everyone for taking the time to be with us here today. As you do leave and go up the rest of your day, I will stay on the end of the call just in case any of you have any last minute questions that you would like to type in. With that, thank you again, Ann. Thank you, Brad. Thank you to Dr. Canasi, who's still not here with us. Thank you, Mizuki. Thank you to all of our residents who took the time out of their day to share their wonderful experiences with all of you. So again, thank you all. Be well and have a great day.
Thank you.
Thanks, Rick.